Let's dive into glute bridges during pregnancy. I'm Dr. Nichelle Goulet, and I'm specialized in prenatal and postnatal movement. So glute bridges are a great skill to work on to keep our glutes strong, which can help decrease discomforts during pregnancy that can happen from pelvic instability. So let's get down onto the ground for the glute bridges. Now, to get down onto the ground when you're pregnant, it's a better idea than to just lay back like this, to slide down to your side, drop your head, and then roll to your back. And same thing for when you are getting up. You'll roll to your side and push yourself up. So glute bridges, I'm going to talk about the activation. So what you're going to do is as you drive up, you are going to use your exhale as you drive up, and you're going to think about a lifting of your pelvic floor and a slight lifting of your lower belly. So there is a video, Deep Core Engagements for Pregnancy, that's good to watch. What I want you to think about is that slight lift as you are lifting up. So you'll see that I'm going to think about pelvic floor engaging and also thinking about my pubic bone driving up and connecting to my belly button for lower belly lift as I drive up. The bigger part to think about than even those engagements of the pelvic floor or the abdominal wall are your glutes. We're really targeting the glutes in this movement. I'm just talking about how to engage your deep core with your breath as you do so. So a glute bridge looks like this. I'm going to inhale, engage my deep core as I rise. You'll notice at the top, I have a nice straight line here. If this is too much of a movement, you don't have to come up this high, but you also don't want to go beyond. We don't want extension of the back. So I'm going to do that again. You can come up, nice straight line, and slowly lower back down. What I don't want to see is that you drive up and plop down. It's a drive up, 1, 2, and lower, 1, 2. You want the concentric and eccentric to be about the same. Now, if that's too much, it's okay if you only go to here, but as long as you're engaging your glutes, and then you lower down. So same thing, it's not that you come up a little bit and then drop fast. It's come up to what feels comfortable, engaging those glutes, and then slowly lower. If this hurts your tailbone or your sacrum as you do this, you can either choose to not do the movement or to not completely come down and put pressure on that sacrum. You can kind of keep your body slightly elevated with this. Another option for glute bridges that you can challenge with, and you'll challenge your glute med, which is the side butt area, which is a big hip stabilizer, is you can take a band, a loop band, put it around your upper knee, and all you're doing is the same thing I just discussed with glute bridges, but you're pressing actively out against the band as you drive up and as you lower down. So this is just a way to challenge your glutes a little bit more and to turn on those glute meds even more. Another option is you can do a single leg glute bridge. So that would be where one leg is up. So you'll see that my knees pretty much stay in line. But what is happening is now one leg is driving up. So this one leg, that's going to be the stance leg, if you will, is going to work a lot harder. As you do this, it's important to make sure that the pelvis doesn't shift, that you keep it nice and in line. So same thing, I'm going to inhale. I'm going to exhale, lift pelvic floor and lower belly as I drive up. So it's going to look like this. Inhale, exhale, inhale, exhale. So you'll see I'm slowly lowering up and slowly lowering down. I'll show on the opposite side. The single leg glute bridge is absolutely a lot more challenging than doing a regular glute bridge. It's not necessarily that the band is harder than this one. It's just different in that it's engaging the glute meds a bit more. So the glute bridge and the bands are for a lot of people as long as it's not causing pain, but the single leg can be pretty challenging. So you'll just have to pick where you're at. So now to get out of this position, I'm going to roll to my side and push up.